today's World Obesity Day. Tell me why World Obesity Day is so important.
I think people have the erroneous impression that undernourishment is a bigger problem in the world than obesity is, and it's actually not true. We now have more people with obesity, with overweight and obesity, than undernourished people on a global basis.
So on this World Obesity Day, we're bringing awareness to the problems that come along with obesity. It carries a big price tag, but it also plays a role in our health and our quality of life and our lifespan. What kind of consequences does obesity have?
There are more than 100 diseases that are associated with obesity. I think the ones that most people will recognize are type 2 diabetes. During World War II in Europe, there was no type 2 diabetes. And around the world, we're seeing a global epidemic of type 2 diabetes. It's all being driven by obesity. But there are other diseases too. About 40% of all cancers are related to obesity. Certainly, non-alcoholic fatty liver disease, the leading cause of liver transplant today, is related to obesity. Sleep apnea, and 100 or so more other diseases.
So obesity has the ability to really impact our quality of life and how much we spend on medical care. Sometimes you hear that there's not a lot someone feels like they can do if they have struggled with their weight. What is the role that lifestyle plays versus genetics and how much weight someone carries throughout their life?
The way we think about the cause of obesity is that we think of genetically susceptible individuals when exposed to an environment that's obesogenic, causes the expression of those genes. So I think people are born with certain genes that make them at risk for weight gain. And if the environment is such that there's, as is in our current environment, ready access to highly palatable and energy-dense food, and a work and play environment that really doesn't take a lot of physical activity to navigate, those set people up for gaining weight. And once weight is gained, it is very difficult to reverse and keep weight off permanently. So there are other factors that can drive risk. Some life events like pregnancy. For susceptible women, weight gain after pregnancy is a particular issue, as is menopause. But I think people who work shifts and have problems with sleep, poor sleep hygiene is another driver of weight gain and obesity. And then stress, financial stress, emotional stress, big driver of risk for obesity.
So how do we overcome these environmental factors that play a role in weight gain?
I think it's very important to see this as a way of trying to minimize the things that are driving weight gain. And because I think too many people have the erroneous idea that all it takes is willpower. We need to eat less and exercise more. Well, that's true. Eating less and exercising more is the pathway to weight loss. But it's more complicated than that. In this environment, it takes a real special skill set. If you have those susceptibility genes, it takes a skill set to be able to lose weight and keep that weight off permanently. So physical activity and diets are important, but I think recognizing triggers of weight gain is something that's very important for all my patients.
And so we're helping people here at Pennington Biomedical to develop those skill sets through our research studies that are teaching people, how to measure their food, how often to eat, what time of day to eat, that sort of thing. Can you talk about the overarching things that we've learned in the last 30 years that we didn't know when Pennington Biomedical opened about obesity?
I think the biggest discovery that Pennington participated in was that for a lot of health benefit, you do not need to return people to a so-called normal weight. That we can get a lot of health benefit with weight loss in the range of 5% or 10%. So for a 200-pound person, if we can get that person to lose 10, 15, 20 pounds, we can really impact their health. We can improve risk for diabetes. For people who have established diabetes, we can frequently get them off of insulin and on lower doses of medications. We can improve blood pressure. With a little bit more weight loss, we can see improvements in inflammatory risk factors and can see improvements in non-alcoholic steatitis, NASH, and sleep apnea with a little bit more than 10% weight loss. So I think the biggest discovery that we participated in was in our work in DBP and Look Ahead that really identified that this modest or moderate weight loss can really bring a lot of benefit. You know, I believe that we need to be more accepting of body size. Body size is an individual thing, and it's not always an accurate reflection of body health. We need to be less accepting of how excess body fat can drive poor health. So for me, it's not about how people look, it's about their health status.
Right. And there are lots of tools that we're testing here at Pennington Biomedical, such as Fitbits, smartphones, other sort of trackers here at Pennington Biomedical. What role do you see those technologies playing as we move forward in weight loss and weight maintenance?
You know, a big phenomenon in the last 5 years even has been the rise of the wearable. So the wearable device that tracks your sleep pattern, the number of steps that you're taking. You can link it to a smartphone, and if you can enter your food intake, and it can track what you're doing there. It can be linked to your scale, and you can track your weight on it. Those things are all wonderful. They're very good for self-monitoring, and self-monitoring is foundational to any change in behavior. You must measure it for it to change. So measuring and tracking activity, diet, weight, really important. But these devices do not do it on their own. And one of the things I'm proudest of about Pennington is that we're able to marry that monitoring to really evidence-based prompting. So you know, our behavioral scientists at Pennington can put in algorithms and systems that can give individuals who are tracking and self-monitoring with those devices and apps, can give them prompts and advice about what to do and what to change so that we can end up with a behavior change. So just wearing the Fitbit is not going to cut it. It really takes changing the behavior around what you're monitoring with that Fitbit. And I think that's where Pennington has played a really important role.
Absolutely. So in addition to your role as executive director and as an active scientist here at Pennington Biomedical, you also see patients. So what kind of tools beyond Fitbits do you suggest for patients who have struggled with their weight, who haven't had success in the past?
You know, I think most often, by the time patients get to me, they've had 5, 6, 10, 15 weight loss efforts. They've frequently been successful, and then they've seen slow, steady weight regain. I think the first thing that I do is reassure patients that this is normal, this is biology, that our bodies want to defend our highest weight, and that if we are successful in weight loss, and sometimes it's hard won, but we're still successful, then the real challenge begins, and that's weight loss maintenance. So the secrets of weight loss maintenance, of keeping off that hard-won weight loss, the secrets there are, first and foremost, physical activity. Another secret to success in long-term weight loss maintenance is continuing medications. You know, it's only been since 2012 that we've had some really good medications available, and they can be used over the long term. So I know my patients always ask me, I've lost all the weight, do I have to keep taking this? And the answer is yes. And the reason is, if they stop, there'll be that weight regain that occurs. So for that hard-won weight loss, continue your medication. When your blood pressure gets under control, you don't stop your blood pressure medication. Well, we shouldn't stop these medications either.
Wonderful. So on this World Obesity Day, what is the biggest takeaway that you want the average person out there watching on our social media networks to take away?
You know, I think the public really needs to understand that obesity is a disease. It drives poor health in individuals who have susceptibility to the disease, that it's not just a matter of willpower, that losing weight is hard work, and when weight loss is achieved, it requires continued vigilance. It's a chronic disease. We need to follow our patients over the long term because we expect relapses to occur, and when they do, we know what to do.
Great. So where do you see Pennington Biomedical going over the next few years in terms of making an impact in lab science and population science and in clinical science on obesity?
Yeah, the really great thing about Pennington is we do have the crosstalk and interaction between basic scientists, clinical scientists, and population scientists. So I think we're going to continue with our work in understanding obesity risk, the triggers that drive weight gain. We're going to be looking at new medications that can be used for weight loss. There are medications in the pipeline that can produce as much as 15% weight loss. We're now up in the range of what can be achieved with gastric banding. And our population group is going to get more and more into translating what we know into the real world. So for the first time, we're going to be starting a clinic where we're not just doing research, but we're developing a model program, a blueprint for primary care doctors on how they can achieve and sustain weight loss in their practices. So the blueprint contains not just knowing what to do, it contains the economic model for how this can be successfully implemented in primary care with our existing billing systems.
Wonderful. Well, we look forward to that. We want to know if there's anything else you would like to add in.
Not a thing. Thank you.